Hi, I'm Garvin. Welcome to our telehealth video series. In this video, I will give a brief overview of what you need to know about nicotine dependence. In particular, I will cover what is nicotine dependence, how do you treat it, and how can you live with nicotine addiction. So we start with what is nicotine dependence. So nicotine dependence is an addiction to tobacco products caused by the drug nicotine. Nicotine dependence means you cannot stop using cigarettes, even though it is causing you harm. Nicotine produces physical and mood-altering effects in our brains that are temporarily pleasing. These effects make us want to keep using tobacco and lead to dependence. At the same time, stopping tobacco use causes withdrawal symptoms, including irritability and anxiety. So what's in the nicotine in tobacco that causes nicotine dependence? The toxic effects of tobacco result from other substances in tobacco. Smokers have a much higher rate of heart disease, stroke, and cancer than non-smokers. Regardless of how long you have smoked, stopping can improve your health. Many effective treatments for nicotine dependence are available to help you manage withdrawal and stop smoking for good. So the symptoms of nicotine addiction. The signs that you may be addicted to nicotine include you cannot stop smoking. You experience withdrawal symptoms when you try to stop. You keep smoking despite health problems. You give up social activities in order to smoke. And nicotine is the chemical in tobacco that keeps you smoking. Nicotine is very addictive when inhaled into the lungs, which quickly releases nicotine into the blood, allowing it to get to the brain within seconds. In the brain, nicotine increases the release of brain chemicals called neurotransmitters, which help regulate mood and behavior. And dopamine, one of these neurotransmitters, is released in the reward center of the brain and causes improved mood and feelings of pleasure. So experiencing these effects from nicotine is what makes tobacco so addictive. Nicotine dependence involves behavioral as well as physical factors. These behavioral associations with smoking may act as triggers, situations or feelings that activate a craving for tobacco, even if you have not smoked for some time. So behaviors and cues that you may associate with smoking include certain times of the day, after a meal, certain places or friends, talking on the phone, stressful situations, driving a car. And tobacco smoke contains more than 60 known cancer-causing chemicals and thousands of other harmful substances. Smoking harms almost every organ in your body and impairs your body's immune system. About half of all regular smokers will die of a disease caused by tobacco. The negative effects of tobacco include lung cancer and other lung cancers or other cancers, heart and circulatory problems, diabetes, eye problems, infertility and impotence, pregnancy and newborn complications, cold, flu and other illnesses, weakened senses, teeth and gum disease, and it affects your physical appearance as well. So next, is how you treat nicotine addiction. So there are many treatments available for nicotine addiction. However, this addiction can be very difficult to manage. Many users find that even after nicotine cravings have passed, the ritual of smoking can lead to a relapse. There are several different treatment options for those battling a tobacco addiction. So you have patches. The patch is known as a nicotine replacement therapy, or NRT. You have nicotine gum, another form of NRT. Nicotine gum can help people who need the oral fixation of smoking or chewing. There's a spray or an inhaler. Nicotine sprays and inhalers can help by giving low dose of nicotine without tobacco use. And there's medications like Nicorette lozenges. Some doctors recommend the use of medicines to help with tobacco addiction. So you have Champex and Zyban. And there's psychological and behavioral treatments. So some people who use tobacco have success with methods such as hypnotherapy, cognitive behavioral therapy, neuro-linguistic programming. So these methods help the user change their thoughts about addiction. They work to alter feelings or behaviors your brain associates with tobacco use. Treatment for a tobacco addiction requires a combination of methods. So keep in mind that what works for one person probably won't necessarily work for another. You should talk to your doctor about what treatments you should try. And finally, how do you live with nicotine addiction? Stopping smoking is a positive change for many reasons. So think of short-term benefits such as breathing easier, saving money, and having better smelling clothes. Long-term benefits include a lower risk of disease, increased chance of a longer life, and a healthier environment for your family. So use these reasons to build your motivation. Lock in your list, or look at your list often, especially when you feel your motivation is lagging. To stay smoke-free, consider these tips. Identify your major smoking triggers and challenges. This will help you solve problems and have a plan to deal with high-risk situations. Seek social or support. The social support you need to stay quit for good. Ask your family, friends, and co-workers for support and encouragement. Practice positive self-talk. Talk of 1 or 2 phrases to use repeatedly for encouragement. And set smoke-free boundaries. If there's another smoker in your household, set boundaries by making your home and car smoke-free. Regularly review the benefits you're quitting from quitting. Look at your list again and up how much money you've saved. So that is important. Keep track of how much money you're saving. Also avoid alcohol. Drinking is a high risk situation. Reward yourself. And finally, there are numerous products available at Lynch's Pharmacy in Douglas to assist you in managing nicotine addiction more effectively on a daily basis, such as patches, lozenges, sprays, gum, microtabs. And that brings this video to an end. So customers of Lynch's Pharmacy can avail of a brand new service we're offering. It's a telehealth program, a Quit for Life program. If you're motivated to finally quit smoking, we can help. We provide a brand new Quit for Life program where we measure your carbon monoxide and peak flow levels daily. We provide you with a structured environment where you can finally kick tobacco to touch for good. Initially, we would suggest a daily consultation in the privacy of our consultation room where we monitor key indicators for you. And after 2 weeks, every 2 to 3 days, you would come to us. The evidence suggests that initially daily consultations provides the most success in overcoming nicotine addiction. So call into us at Lynch's Pharmacy in Douglas or ring 021 436 6923 to find out more. Thank you for watching. Stay healthy and stay informed.